We're live. Hello, and welcome to our Facebook Live series, Ask the Vision Loss Experts Coping with COVID-19. My name is Dr. Trisha Grant, and I'm the Senior Director of Low Vision Research at the Chicago Lighthouse.
And I'm Dr. Brian Walensky. I'm a low vision optometrist in New York City, and I work with OrCam Technologies. It is our intent in this series is to discuss topics and engage people and share information as pertains to vision loss during this time of COVID-19. And in these episodes, we want to bring guests and topics that concern everyone in the community during this time.
We welcome everyone to join, whether you or a loved one are visually impaired or blind, or you just want to learn more about the experience of people who have vision loss, especially during this time.
So thank you to everybody who's been joining us each week. It's great. If you know someone who you think may benefit from these discussions, or you think they'd be interested, we ask you just to take a moment, hit that share button on this post and share it with your friends. Today we have a great guest joining us today, but before we introduce him, I wanted to ask a question, as we always do, sort of our question of the day to the audience. So last week we talked about, what was our guilty pleasure? So this week we said, well, let's do the opposite. What is one healthy habit you've started since the quarantine? What is the healthy thing you've been doing? So you give us your answers, put it in the comments below, and then later on we'll read them out.
And last week we talked about assistive technology, and we heard from one of our experts in the field, but we like to mix it up and hear from our community members as well. So today we have joining us Andy Fabino, and you may have virtually met Andy in the comment sections during one of our live sessions. And we love the messages that Andy shares. He's always very caring and positive. So today we want to officially introduce him to our audience. And a bit about Andy: he is a Chicago native, he's a diehard Cubs fan, and a community member and a family man. And I met Andy at the Chicago Lighthouse about 6 years ago, where he's very active in our research. And I have to be honest, there's only a few times that I've seen Andy outside of his Cubs gear. And you'll know today that he is wearing his Cubs jersey. So thank you for joining us, Andy.
Good morning. Good morning, Dr. G and Dr. B. I made it to the show. What's going on?
Thank you for being here, Andy. Welcome. And you're making me miss baseball. So hopefully we can get back to baseball at some point sometime soon. Well, as you know, because you've been responding to us also in the comments section and been every week, and we even discussed some things in the past with you. We always want to start out, what has been your healthy habit since you've started this quarantine?
My wife has me eating fresh cucumber, celery, and carrot, anything with crunch. So I'm eating raw vegetables.
All right, that's good, because today we're going to talk a little bit about health and what keeps us healthy. So that's great. Keep eating that, and I'll talk about even eating those greens, which are great for the eyes. But when we say, health, people often think of health as such as your heart, your blood flow, other things come to mind, your regular doctor, getting a physical. But we want to talk about health, which really includes our mental health, our physical health, and our social well-being. Andy, you have faced a lot of personal challenges that you've had to overcome in your life. We've talked about it. Can you tell us all a little bit about, some of those, and really how those challenges in the past really prepared you during this time?
Well, it'll be 9 years this September. A tragic episode took place, and it left me incapacitated in the hospital for over 2 months in the ICU, in a coma for 14 days. And when I was able to get the the thing out of my throat, and I couldn't see, I was left blind. But as I said, I think being laid up and not being, because my muscles atrophied, I had time to lay on my back and figure out what blind was and living in the dark. So I had to go to rehab, and I went to a rehab center for almost 2 months, lived there. And then I got involved with Trish and the Brainport, and now I'm on television. Look, Mom, I'm on television.
Or on Facebook Live. It's great. And you definitely have. How did it prepare you? Do you feel like what you overcame? You mentioned to me that you had to learn mobility, orientation mobility. You had to learn how to use your cane. Do you think that, the overcoming those challenges, because now you were blind, does that help you kind of deal with all of the social isolation that's going on right now?
Working and learning how to be blind and learning how to be okay with yourself definitely helped with being isolated, because you are away from all of your friends and all of your loved ones. Yeah, it definitely helped. Being at Icree Wood at blind school for 9 months taught me to, like you said, we talked about using mobility. I learned how to use a blind cane and read Braille with my finger. Insane. It's great. It truly is. If you ever want to get mad at someone, type them a letter in Braille. Don't go nuts.
So when the quarantine first started a couple months ago, you and I were talking about physical health and how much physical activity is linked to mental health. And you told me that when you first lost your vision, one of the things that improved your state of mind was your physical activity, and you were doing a lot of it, and you actually lost a lot of weight in the process. And yep. But everything you did was from home, which I thought was really fascinating. So what type of exercises were you doing? Can you share some of those secrets with us? And also, what are you doing today to help improve your mental well-being?
Well, I began on a treadmill. We bought a treadmill, and I thought, I'm going to start working and walking 3 miles a day to music. Well, nice. I walked a total in 1 year. I went somewhere in Idaho, picking potatoes. So I walked 3 miles a day. I did the old 1, 2, 3s, sit-ups and push-ups, got up to 100 push-ups a day, arm curls, and it made me feel, man, listen, when you work out, I don't care if you sit on your couch and rotate your arms 100 times. The endorphins that get released after you work out put you in such a better state of mind. It really does. And as far as today, I live in a condo. They don't want you on a treadmill. Okay, I understand that. So I sit outside. This morning I sat outside and I listened. And I heard cardinals singing, female red cardinals. And I remember them. And their voices are beautiful. So for 15 minutes during coffee and me time, I reflected and listened to cardinals. And it was incredible, relaxing.
No, that's great. That's even good to know. Sometimes it's not that strenuous exercise like you're talking about walking on a treadmill, but just having that relaxation, that therapy as well. And we're talking about health, and during this time, a lot of doctors and places are opening up even again, but still virtual care or telehealth is going to be a thing. And we discussed that with Dr. Scherer, that they're doing that at the Chicago Lighthouse, and that's actually becoming more widespread throughout. Andy, had an issue. He gave me permission to talk about it with his eye. And we did our first telehealth experience together for me and for Andy. So Andy, I wanted to ask you what you could share from your experience, from your first sort of telehealth experience, and you could talk about it.
Great, sure, thanks. My eye was leaking like a faucet and I couldn't turn it off. So I asked Dr. Grant, did she know anything about it? And she said, put me in touch with Dr. Bryant. So I did. And my wife helped look into my eye with an iPhone. And you said nothing looked wrong, which made me more paranoid because it said nothing wrong. Why is my eye leaking? And you told me that I probably had dry eye. Again, how could you have dry eye when you're leaking? But you prescribed this over-the-counter medicine, and I don't have dry eye anymore. It doesn't leak.
That's fantastic.
Great. I'm glad you had a good experience with it.
I did.
Just by easing those tensions of what's going on with my eye, what's happening, or even any other thing going on in your health. So at least, the telehealth works.
Yes.
Yeah.
Times that you can do things, virtually or over the phone or even over a computer, but there's definitely those times where you do need to go into the office as well. But I'm glad that it was able to help.
Yeah, I think I think it's great to hear from, because yeah, we are scrambling to get things together and offer this care virtually. So to actually hear from someone, this can be done. I mean, even if it wasn't the quarantine, it would have saved you a visit into the office, which is, I think, really important.
Yep.
So as we're speaking about cities reopening, a lot of cities are reopening across the world. And how do you, Andy, plan to rejoin society? Do you have plans to see people?
Actually, I kind of broke quarantine a little bit. I couldn't take not seeing my grandkids. I have an 8-year-old grandson and a 3-year-old granddaughter, and I love them to death. And my son and his wife both were home from work when they quarantined for 9 weeks or whatever we were in the house. So I know my grandkids, and my son and his fiance didn't go anywhere. So we felt absolutely comfortable going there. We had a barbecue. The kids climbed all over me. My granddaughter went swimming and fell asleep in my arms.
Aww.
Great afternoon. And it's important. Family, friends, you can open your circle a little bit and then somebody else in just a little bit. A little bit goes a long way today, boy, let me tell you.
But just to remind everybody too, wherever you're located, because different parts, I'm in New York City, where of course we're trying to socially distance and keep that going and keep our masks on. So really pay attention to your areas where you are. And, we have a lot of international viewers as well. So wherever you are in your countries, listen to the news, listen to what is recommended by your area. I work with OrCam, as everybody knows, and we're in 50 different countries. So we have people from all over the world watching. So say hi, Andy.
Hi.
So I just want to remind everybody, I'm Dr. Brian Walensky. This is Dr. Patricia Grant, and we're here discussing issues related to vision loss during COVID-19. Thank you for joining us. And our question of the day, and I've already seen a lot of people have responded with some good things. We'll get to that. But the question is, what are you doing health-wise or healthy choices that you're making during this time of quarantine? So Andy, things are opening. You talked about that you broke the rules a little bit. You went and saw your family, and I don't blame you. It's nothing your grandkids, I'm sure. But things are opening up. What is some of the concerns that you have about that? And what do you, of course your family, but what else are you looking forward to?
Well, to answer the first question, I'm afraid to go out alone because I don't know, again, what I'm touching, what I'm tracing, who's wearing a mask, who isn't, how close am I? So I'm looking forward to going out and going to an outdoor restaurant with my wife and, spending some time together away from our kids. But I want to be with someone that's sighted so they can tell me, Andy, we're with people around you, but they're wearing masks. Everybody's on policy. I can then relax more. So, just like everybody else, I'm excited, but leery.
And I know one thing we talked about is you're excited to get back, even like going to the Chicago Lighthouse. And I know we're going to get you that demo of OrCam.
I'm excited about the OrCam.
Yeah, so that's one of the things we're going to get done when you can get back to the Lighthouse, which I think hopefully it's going to be soon. And just
yeah, we are reopening today, or we reopened yesterday. So yeah, we will talk about that. But what you mentioned is really important. It's an important reminder to everyone that when you're out in the world and you're starting to merge with your peers again, to just be mindful of not only what the dangers are for you, but those around you. So just be sure you're, if you can, you bring some disinfectant wipes out with you and just kind of help to do your job. Don't just look to what's important for you, but think about others who maybe can't do that or are not sure who's around them. So just really be mindful. I think that's the important message in what you're saying.
Yep.
So Andy, are there any last thoughts that you'd like to leave us with today?
Well, find a reason to find a happy thought. Make yourself smile. Call a friend. And be kind to one another.
Yeah.
That's it. That's it. That's all.
And eat your vegetables, right?
Except for the green ones.
Thank you, Andy.
All right, guys, take care. Thank you.
Thank you for joining us, Andy.
You're welcome. Bye now.
Bye.
So that was great. Always love talking to Andy. Thank you,
Yeah.
everybody. And I'm sure he's like logging right back on, and he's going to leave some comments as well. But you know, we've been asking everyone their healthy habits. So let's read some.
Yeah.
Dr. Grant, did you see?
Yeah, I have Kim Winfield who says, I walk daily with my son. That's so important. That's what Andy was talking about, walking. Elsa Caballero, daily walks with music. So again, Andy, I think a lot of people are finding that the walks are really nice.
Except well, Zoe Zavala says, exercising 30 minutes a day, eating healthier, and drinking lots of water. That's important. I mean, a lot of people are exercising, walking, drinking water and staying cool. Because as you mentioned, in Oklahoma, it's in the 90s. It's going to be 80s here. I think I'm using my air conditioner for the first time later today as well.
I like this one from Alicia Weber. She said, I actually decided I would not gain weight during this quarantine. I will work to lose weight, and I've lost 7 pounds. That is amazing. Funny how it took the quarantine for me to become strong enough to do that. And that's really impressive. I mean, a lot of people are saying the opposite, that, you know, they've put on weight because of not being able to get outside as much and not being able to go to the gym. So good for you, Alicia. That's really impressive.
No, that is, because it's really hard to stay motivated also.
Very, yes.
Doing things different, not be able to go out, just being home.
Yeah, just the schedules are just different and off, and it's difficult.
Like knowing what day it is.
Yeah, knowing what day it is. Stephanie, Berryman, I'm sorry if I said that wrong, Sims, and she says, I'm doing Pilates regularly now and eating more veggies and watching portion amounts. Oh, she's lost 20 pounds. So another weight loss champion during this time. That's, again, really impressive.
That's great. That's wonderful.
So Dr. Walensky, I'm putting you in the hot seat. What is your healthy habit? What is your healthy habit?
What is my healthy habit? Well, I unfortunately, poorly, it is a lot of walking. So what I've done is, so I do emergency care 2 days a week. So I am walking to work. If some days I'm walking the full way, which is about 3.5 miles. And some days if I am taking the bus, because there is a straight express bus that I take, and there's not too many people on it. People are really socially isolating on there. Initially, I was very nervous to take the bus at first.
Yeah, I understand.
Gotten a little used to it, and I'm wearing a mask. I'm social distancing, but I'm walking like halfway and then taking the bus if it's rainy or something. So that way, at least I'm getting that exercise in. But that's mostly what I've been doing. I need to eat healthier, so I need to be like you guys.
I know. Very motivated.
Easy greens. Yeah. What about you? What have you been doing?
Yeah, I would love to say that I've been, I've lost 20 pounds and I've been working out every day, but it does get hard with my schedule. So one thing that I am doing every morning is I ask myself 3 questions, and I did get this from someone, so I don't know who to credit it to, but it's been very helpful. So every morning I ask myself, what will I let go of today? So if there's something bothering me from the day before, I ask, myself to let go of it. What am I grateful for? And that's because gratitude is really associated with happiness. And then what will I focus on? And that's really just to set my intention for the day. And I try to be really specific about these things so that later in the day, if I find myself distracted or emotional about something, I can just, kind of go back to that and remember those 3 things. And it really does help me stay balanced in my day. So I've been really focusing more on mental health than physical health, but it's all really important. It's all important.
And that's great, because even like here, just like you were saying, Teresa Bleeker mentions that she's, something helps her mental health, like you were saying, whatever you can do to help that health. Because when we mention health, like we said, it's not just, heart, blood flow, everything else going.
Yeah, everything.
Blind. So she mentions that she's legally blind. She swims as much as possible. It's great exercise, which definitely is good for her mental health. And I agree with that.
That's great. I do too.
To do that.
Yes, I agree. So, so you've done a telehealth visit with Andy, and I imagine that you're doing a lot of those right now.
Well, I did the first one with Andy, and then I actually had a few more afterwards because I sort of got in my own comfort zone
Yeah.
about.
So it's understandable that someone who's lost their vision and who has gone, they've gone to the ophthalmologist and they have told them there's nothing more they can do. Then they've gone to their low vision rehab, they've gone through the whole program, and now maybe they're not seeing their healthcare provider or their eye care provider on a regular basis. So what would you say to someone like that? Why is it important to continue to see an eye care provider?
So I actually get that a lot. I'll ask people, when was your last eye exam? To somebody who's either they have Stargard's or they've lost their vision to macular degeneration and they're elderly. It's all ages. And I always get, oh, it's been a bunch of years. Why should I go? I have, or somebody, let's say, who lost their vision to RP. They'll say, I went 5 years ago. What's it do? They're just going to tell me I still have RP. Well, the reason why I think it's important to kind of still go for your eye exams, whether you're visually impaired, whether you're blind, whether you know what condition you have and diagnosed this, again, if you know there's no treatment for it, why am I going? Well, one is, there's a bunch of reasons. One is that actually the view inside the eye is to the rest of your body. So it's like, look, the window to your soul, they say, the eyes, it's true. So through the eye, we could see diabetes, we could see high blood pressure, we could see a lot of different things. Certain inflammatory disorders can be things in the body like autoimmune disorders, like lupus, arthritic conditions. So there's a lot of different things that we could see through the eye, which is important to go. Also, what's important to know is just because you have one condition doesn't mean you can't get another. So if you have, let's say, macular degeneration, that doesn't mean you can't get glaucoma. You can. So it's still important to follow up and be evaluated. As well as, so somebody might say, well, I'm not visually impaired. I am blind, and the treatment, whatever, is not going to bring any of my vision back. But again, I said, you want to make sure that the rest of your health is okay. But you're also going because what if you do develop a glaucomatous situation? High pressure can actually cause your eye to hurt. And if you have a painful eye or something is actually occurring that, there's another type of eye disease happening, we don't want a situation where, sorry to say it's a bad thing, but a surgical situation has to happen where you need something very seriously done to the eye. So I think, just go for that examination. If they say just come back every 1 year, every 2 years, just do it. It's a good thing to do. It's a good checkup. And also what's great is that your doctors are probably up on whatever research there's out there. And they're also up on whatever assistive technology is out there. I'm hoping they are.
Very true, yeah.
I try to educate people. Right now, I'm doing professional relations and clinical relations for OrCam and trying to get more doctors to understand how assistive technology and things like OrCam can help people. So really, we're trying to educate doctors, and that's where you're going to find out all your information.
Exactly.
Yeah, Dr. Grant, I know you've done some research on the importance also of continuing to see an eye doctor and eye care. Specifically if you're at risk for diabetic eye disease, which is huge.
Yes.
Can you tell us a little bit about your work in that?
Yeah, so I've been studying health behavior models to understand health actions, and these models can be applied, and they actually have been applied to a lot of different health problems. But the one I've been studying, as you said, is diabetic retinopathy, and that's because if certain actions are taken before severe vision loss is encountered by an individual, they can actually prevent the vision loss. So, but when a person's trying to make a health decision, like, should I go to the doctor this year? Should I take my medication today? There's a whole mechanism behind that. It's not just as easy as yes or no, but there are a lot of resources that go into that. So what I've been studying is to better understand that mechanism and to see how healthcare professionals can contribute to making those decisions. So what can we do on our end? What education is needed? If there are barriers, how can we help patients work around those barriers? Because sometimes you look at if someone doesn't take their medication, well, why didn't they take their medication? It's just so much more than they just didn't take their medication. There's a lot going on there. So that's really what I want to understand, is to continue to educate providers on the information that patients need and educate patients on the information that they need, and to make sure that they're equipped with that. It's always really important to know, what are you at risk for? And like you said, some of these things you brought up today are very important, and I bet a lot of people don't know this information. So it's just keeping people very informed so that they can also be a participant in their healthcare. So that's what I'm studying. It's a small area of my research, but it's really the one I'm most passionate about. So I'm working on manuscript now, and hopefully I have more to share in the future.
Great. No, I'm looking forward to reading that. I like how you mentioned I like how you mentioned medication. And
Yeah,
the importance to stay on your medication. So many people, because they say, "Oh, I'm not feeling ill," or "I'm not feeling sick," or "I don't
exactly.
feel my eye pressure." So I hear so many often, "Oh, I forgot my medication yesterday. I forgot my glaucoma medication, but I don't feel any pain today, so it's okay. I missed this and skipped." It's actually not. You really need to stay on track with your medications. I myself understand. I take a cholesterol medication that I
Yeah,
sometimes miss, and I got to
yeah,
get at it. And we all have to. We all have to try harder.
yeah, it's true. And if we think about how important it is to eat well and to exercise daily, we know that it's important, but obviously things get in the way. So I tend to think of it like that, when I'm looking at why people are not going to the doctor, why they're not taking their medication. It's hard. It's really hard to have healthy behaviors. So we really need to, it's our job as healthcare professionals to really help people get there. So
I
that's
think we're going to have more of a reach with telehealth as well,
yes,
because people
absolutely.
can instantly be able to
Yes,
reach to their doctors. And I think that's
definitely.
going to cause better compliance, which is going to be great.
Definitely. So I just wanted to, we did have a couple questions from last week that we missed. So Dr. Walensky, I think that you can answer this one. Is there any work being done to get insurance to start covering some of these assistive devices? This is a really great question.
It is, and also hard to answer.
Hard to answer. Yeah.
One is because, well, I want to talk globally for a second, because we do have, people listening from all over the world. It really depends on where you're from. So we know in like the
Right.
US, Medicare is not covering any assistive technologies, but you go to places like Germany or the Nordic countries, and they provide assistive technology to their citizens. Here, state agencies will cover devices, but you have to go through their assessment, and it usually is only for people who are working. So you have to prove that you're using the device for work. And even everyone knows, I work for WarCam, so there have been
Right.
devices approved by certain state agencies. It just depends on where you are, what the rules are within the state. As far as medical insurance companies, I wouldn't say no, it's just rare. I'm
Mhm.
hoping that in the future, that they will. There is work being done to try to get Medicare and medical insurances to cover the assistive technology. I mean,
Yeah.
they cover technology, they cover things for other disorders. Someone who's
Right.
diabetic can get certain items covered. Someone who's if for someone who's paralyzed and they want a wheelchair, this will be covered. So there's a lot of things that are covered for other individuals, but for vision, for some reason, it's not. It was just written a long time ago.
Right.
You can also check, I get very surprised sometimes that some vision plans here in the US will give you a certain amount of money. So really it's asking your eye doctor if your vision plan will cover any part of it. So sometimes it's part of it. And it's also seeing what there's certain low-cost loan programs as well.
Mhm.
You can check out grants. There's all sorts of resources out there. I would
Yeah.
say whatever you're interested in, contact those companies. They believe me, they've been researching it. They want
Exactly.
to be covered. So ask those questions. Let us know, and I'm sure there's people out there to help. And
Yeah.
it's
Yeah.
a tough question to answer, because the answer is yes and no for insurances. It's really about also assessments. So we know through the VA system, they don't just give something away. You have to go through an assessment, and you have to be
Correct.
approved, and you have to, so it's not just, oh, I want this, I get this. So
Right.
there'll be some approval system hopefully in the future with Medicare
Yeah.
and insurances. I hope so.
Yeah, I hope so too. I know there's definitely a lot of interest in the field. People in the field feel very passionate about this. The Chicago Lighthouse feels very passionate about this. So we know we have some work to do. We're planning to do it as well. So there is definitely a push for it. So again, it's very hard. It's a hard system to,
I'm very passionate about it. I wish
yeah,
I
I
could
think we all are. We really all are.
for all
To
my
see these
patients.
devices, yeah, to see these devices and what they do for individuals and our patients, it's hard not to feel passionate about it. So we are working behind the scenes.
There is work being done, and these technologies that are coming out today are amazing. There's amazing stuff happening. The artificial intelligence the work being done at OrCam at their headquarters is amazing out
Yes,
there.
it really is.
And I look forward to the future of it. So
Yes.
Dr. Grant, there's another question what we have for you as well. You could probably answer this one. So how do you know if I qualify for a research study?
Yeah, that's a great question. We have screening criteria, and a lot of times what we'll do, especially for our visually impaired and blind community, is a lot of that pre-screening will be done on the telephone. So if you find a research study, and again, if you go to clinicaltrials.gov, that's a great place to find clinical trials. If you find one that you're interested in, I just recommend you call the study team, have them go over the pre-screening with you. In addition to going over the pre-screening, they'll also tell you what's to come. So normally if you pass the pre-screening, they'll have you come in the clinic to do another screening. But we will explain to you what will happen in that clinic screening, so that if you know there's some criteria that you're not going to fit, we won't have you come in for that clinic visit. So we're trying to eliminate you coming into the clinic unless you have to. So the recommendation is to either just go through often, and if we're recruiting for something, we'll list that screening criteria right on the form, like in a little bit broader, and then we'll get really detailed once you give us a call. So just call the study team. There's always a contact number. We really want research participants, so we try to provide as much information as possible to contact us. So the best thing to do is just give a call to the study team.
Exactly. No, that's great advice. And, speak to your doctors too. Your doctors might know studies that are going on.
Correct.
That's definitely what I would suggest.
So I just want to throw out here, if you missed part of the show today, or if you'd like to replay any of our previous episodes, please visit our Ask the Experts webpage at www.chicagolighthouse.org and type in Ask the Experts in the search menu. In addition to past episodes, you can also link to the resources that we mentioned during our shows.
Definitely. And I want to thank Andy. Thank you, Andy, so much.
Thanks, Andy.
Pleasure to talk to. And I'm glad your dry eye worked out okay. Thanks for coming on and letting us talk about it and about your experience. So until next week, everybody, thank you so much for joining us.
Thank you.
Everyone, to stay well, wash your hands, and remember, don't touch your face still.
Bye.
Bye.
Bye, everyone.